I want to talk about a vital aspect of men's health that most men are completely unaware they have total mastery over. Our focus today is on your vascular system, specifically how you can achieve a remarkable boost in blood circulation throughout your body, including to the regions most critical for male performance, simply by using a 5-minute protocol that can be executed anywhere and at any point in your day. I understand the claim of a 5-minute fix might initially sound exaggerated, but rest assured, the physiological principles behind this approach are unequivocally sound. When you grasp the fundamentals of blood circulation and the factors that impede it, you gain the ability to essentially recalibrate your vascular network, effectively reopening circulatory channels that may have been subtly restricted for years without your knowledge. It's essential to recognize that your blood vessels are not passive, rigid tubes. They are highly dynamic, living structures whose diameter constantly adapts in response to neural signals, hormonal input, and localized tissue demands. The arterial walls contain smooth muscle tissue that can contract, narrowing the vessels and limiting flow, or it can relax, leading to vasodilation and a significant increase in blood circulation. The reality for many men past the age of 40 is a state of chronic mild blood vessel constriction. While this level of restriction may not immediately manifest as noticeable health issues, it's often sufficient to significantly compromise function, particularly in areas like the genitals where the vessels are inherently smaller. Fortunately, this vascular constriction is not a permanent state. It can be quickly and effectively reversed with targeted techniques. Let's delve into the underlying physiology of what happens inside your body. The inner lining of your blood vessels, known as the endothelium, is responsible for synthesizing a critical molecule, nitric oxide, NO. Nitric oxide functions as the master switch for regulating vascular tension. When it is released, it communicates with the smooth muscle surrounding your arteries, instructing it to relax, a process called vasodilation, the widening of blood vessels. Simply put, an abundance of nitric oxide translates directly into a higher volume of blood flow. As men get older, there is a natural deterioration in endothelial performance. Your blood vessels generate less nitric oxide and become less sensitive to what is produced. This is a foundational factor contributing to the decline in male function often associated with aging. The good news, which should excite you, is that endothelial health is extraordinarily receptive to immediate intervention. You can initiate a surge of nitric oxide release and enhance vascular responsiveness in a matter of minutes through targeted techniques. The 5-minute regimen I'm revealing utilizes a powerful synergy of three distinct strategies for magnifying blood flow. We will systematically stimulate nitric oxide synthesis, engage your parasympathetic nervous system, the body's rest and digest state that encourages vasodilation, and introduce mechanical pressure shifts that compel your vessels to expand. By executing these three mechanisms concurrently, the resulting effect is both potent and instantaneous. Our first step is a specific rhythmic breathing pattern, not a general exercise, but a precise calibration designed to maximize both nitric oxide generation and parasympathetic activation. Here is the exact method. First, breathe in deeply through your nose for a 4-second count. Crucially, initiate the inhale by filling your belly before expanding your chest, a diaphragmatic technique that optimally stimulates the vagus nerve, the chief conductor of your parasympathetic system. Next, you will hold your breath for a period of 7 seconds. This intentional breath holding induces a transient oxygen shortage, prompting a compensatory vasodilation as your body scrambles to open blood vessels and maximize oxygen delivery. Following the hold, exhale slowly through your mouth for 8 seconds, producing a subtle whooshing sound to release the air. This extended exhale further activates the parasympathetic response and aids in relaxing musculature, including the smooth muscles of your arteries. Now, for the critical element often omitted from breathing routines. While you are performing the 7-second hold, you must gently hum. I know this sounds unconventional, but the science supports it. Humming generates vibrations that resonate within your nasal passages and sinuses, areas prolific in nitric oxide production. Studies indicate that these vibrations can boost no output by up to 15 times compared to silent breathing, Complete this entire cycle. Inhale, hum, hold, and exhale 5 consecutive times. This sequence takes approximately 90 seconds and establishes the vital foundation for your vascular reset. We now transition to the second pillar of the protocol, targeted isometric muscle contraction. Isometric exercise, tensing a muscle without any movement at the joint, works by temporarily constricting blood flow to the contracted area. When the muscle is released, the body immediately responds with a phenomenon known as reactive hyperemia, an intense rush of blood that far surpasses the normal baseline flow. This surge is not limited to the contracted muscle. It generates a generalized systemic boost in circulation. The muscle groups we have selected are deliberately chosen for their size and their beneficial impact on blood flow to the pelvic region. We will engage the glutes, the inner thighs, and the lower abdominals in a rapid, sequential manner. Begin with your gluteal muscles. Clench your buttocks together with maximum force as if you're attempting to secure a small object between them. Sustain this peak contraction for 15 seconds, making certain to maintain your normal breathing rhythm. Holding your breath will trigger an undesirable different physiological response. Upon the 15-second mark, release the tension abruptly and completely. You should instantly sense a warm, invigorating rush as blood perfuses back into the tissue. Immediately transition to your inner thighs. Press your knees together firmly, generating maximum pressure for 15 seconds, again breathing normally throughout the exercise. Then release fully, feeling the corresponding blood surge. Conclude this segment by contracting your lower abdominal muscles, actively drawing your navel inward toward your spine and tightening the entire lower core. This action effectively engages your pelvic floor musculature as well. Hold this contraction for 15 seconds before releasing. This entire tripartite sequence of isometric contractions lasts roughly 90 seconds and is crucial for creating profound reactive hyperemia throughout your lower body and pelvis. Finally, we move to the third component, dynamic movements designed to induce strategic pressure variations within your abdomen and pelvis. These motions serve to mechanically massage your internal organs and blood vessels, promoting circulation while simultaneously activating the neural pathways responsible for governing vascular tone. The first dynamic movement involves pelvic tilts. Stand with your feet spaced shoulder width apart and a slight bend in your knees. Tilt your pelvis forward, creating an arch in your lower back and pushing your rear end out. Hold for 2 seconds. Next, reverse the tilt, tucking your tailbone under and flattening your lower back. Hold for 2 seconds. Perform 10 smooth, alternating cycles. This rhythmic action generates pressure fluctuations in the pelvis that massage the blood vessels and drive flow. The second movement is hip circles. Place your hands on your hips and execute large, deliberate, and slow circles with your pelvis. Visualize stirring a giant pot with your hips. Complete 5 circles in one direction and then reverse for 5 circles in the opposite direction. This exercise not only further stimulates pelvic circulation, but also stretches and loosens any tight muscles in the hips and lower back, which can otherwise impede optimal blood flow. The final dynamic movement is a series of deep squats. Descend as though you are sitting into a chair, reaching a depth that is challenging but comfortable for you. Full depth is not necessary. Hold this lowest position for 3 seconds before powering back up to a standing position. Perform 5 repetitions of this movement. Squatting generates substantial pressure fluctuations in the abdomen and pelvis. It momentarily displaces blood from the area, which is then followed by a powerful, rejuvenating rush of fresh blood upon standing up. These 3 movement exercises collectively utilize approximately 90 seconds, bringing our comprehensive protocol time to just about 4.5 minutes. We dedicate the remaining 30 seconds to what I refer to as vascular visualization. While this may strike some as a purely mental exercise, robust research confirms that targeted mental imagery has the capacity to influence concrete physiological processes, including measurable changes in blood flow. Studies employing thermal imaging have demonstrated that individuals can genuinely enhance circulation to specific body parts merely by concentrating on the sensation of warmth and unimpeded circulation in those areas. For this final half minute, close your eyes and mentally depict a torrent of warm, highly oxygenated blood surging effortlessly through your entire system. Envision your blood vessels as expansive, wide open conduits with blood traversing smoothly and efficiently to every extremity, with a particular focus on your pelvic region. Mentally channel warmth and vitality spreading throughout your lower torso. This mental component is far from insignificant. It serves as a synergistic amplifier to the physical techniques you just executed. Let's now discuss the critical question of when and how often you should incorporate this 5-minute protocol. The true advantage of this method lies in its dual nature. It is both immediately effective and delivers compounding benefits over time. You will definitely perceive an immediate uplift in circulation and responsiveness right after performing the routine, but the most profound gains are accrued through consistent practice. For immediate peak effect, execute the protocol 15 to 30 minutes before any activity where you desire optimal function. The vascular enhancements achieved typically persist for several hours, thereby establishing an ideal window of elevated blood flow. For the long-term cumulative benefits, integrating this protocol into your daily routine, ideally first thing in the morning, will systematically upgrade your baseline vascular performance over a period of weeks and months. You are effectively conditioning your blood vessels to be more responsive and maintain superior tone. Many consistent practitioners report a noticeable improvement in their baseline function within a short window of just 2 to 3 weeks. You are welcome to perform this protocol multiple times each day if you wish, as there is no negative consequence to improving your circulation more frequently. Some individuals incorporate it into both their morning and evening routines, while others opt to practice it whenever a few minutes of privacy are available during their workday. Let's now explore a few advanced modifications and enhancements to this protocol that can amplify its effectiveness even further. The first powerful addition is incorporating temperature contrast. If you have access to a shower, directing a sequence of alternating warm and cold water onto your lower body acts as a potent vascular training exercise. The warm water facilitates vasodilation, while the cold water induces vasoconstriction. By rapidly switching between these two states, you condition your blood vessels to become more dynamic and responsive. Following the completion of your 5-minute routine, you could spend 2 minutes actively alternating between 30 seconds of warm water and 30 seconds of cool water, targeting your lower abdomen, inner thighs, and the pelvic region. This thermal contrast therapy significantly magnifies the vascular training impact of the core protocol. A second enhancement involves the addition of specific acupressure points known to directly influence blood flow. According to principles of traditional Chinese medicine, there is a key point situated on the inner ankle, precisely 4 finger widths above the ankle bone, which is recognized for promoting circulation to the pelvic area. After finishing your main protocol, apply firm pressure to this point on both ankles for approximately 30 seconds each. The pressure should be substantial enough to elicit a deep, radiating sensation, yet should not cause pain. Another relevant point is located on the lower abdomen, about 4 finger widths below the navel, an area traditionally linked to reproductive wellness and pelvic circulation. Massaging this spot with firm circular movements for 1 or 2 minutes post protocol can further boost the intended blood flow effects. We should also consider how body position influences the protocol's efficacy. While performing the techniques while standing is the most convenient option for most scenarios, certain positions can provide an even greater advantage. For the breathing component, lying supine on your back with your hips slightly elevated on a pillow is beneficial, as gravity assists blood flow toward the pelvic region, thereby reducing the workload on your heart. For the isometric contractions, a reclined position enables you to generate more intense, forceful contractions, since you are not required to maintain balance as you are when standing. This increased force leads to a more pronounced and powerful reactive hyperemia upon release. The dynamic movement component generally yields the best results when performed standing, allowing for maximum range of motion and complete muscle engagement. Ultimately, the protocol is adaptable and can be adjusted to suit your specific preferences and circumstances. Next, we must address the absolutely critical role of hydration in maintaining peak vascular function. Your blood is composed of approximately 55% plasma, and this plasma is predominantly water. When you are dehydrated, even slightly, Your blood becomes more viscous. In simple terms, it thickens. Thickened blood does not navigate your circulatory system easily, creating friction, particularly as it attempts to pass through the intricate network of smaller vessels in your extremities and, crucially, the genitals. A significant number of men are living in a state of chronic mild dehydration without realizing it. A simple self check. If your urine color is darker than a pale yellow hue, you are not consuming enough water. For optimal vascular performance, you should maintain a hydration level where your urine is consistently pale yellow or nearly transparent. For this 5-minute vascular protocol to achieve its peak results, you must be properly hydrated. Consuming a generous glass of water about 30 minutes prior to performing the routine ensures that your blood volume is ideal and that your blood possesses the correct viscosity for maximum possible flow. Furthermore, there is an established link between hydration and nitric oxide production. The complex enzymatic pathways responsible for generating nitric oxide function with greater efficiency when your body is well hydrated. Therefore, maintaining proper hydration directly amplifies the effectiveness of the breathing and humming elements of the protocol. Let's also consider the impact of meal timing on your vascular response. Following the consumption of a large meal, a substantial volume of blood is immediately redirected to your digestive system, a common reason why many people experience post meal lethargy or sluggishness. The blood engaged in digestion is, by necessity, blood that is temporarily unavailable for other bodily functions. To ensure the optimal vascular response from this protocol, it is highly recommended to perform it either on an empty stomach or, at minimum, a full 2 hours after eating. This timing guarantees that the maximum available blood flow can be effectively directed and utilized where you want it, rather than being sequestered by the digestive process. Similarly, if you plan to use this protocol as preparation for intimate activity, being mindful of your meal timing becomes even more important. A substantial, heavy meal consumed within 2 hours of intimacy can severely diminish function simply due to the intense competition for blood flow between the digestive tract and other key areas. Let's take a moment to understand the enduring connection between this vascular routine and the long term health of your endothelium. With every successful trigger of vasodilation that you achieve using these techniques, you are essentially providing a vigorous workout for your endothelial cells, the vital lining of your blood vessels. Much like any other tissue in the body, when the endothelium receives consistent and appropriate stimulation, it responds by growing stronger and more highly functional. Therefore, the consistent practice of this vascular training does more than just temporarily enhance blood flow. It fundamentally improves your endothelial function, which in turn leads to a superior baseline blood flow, even during times when you are not actively engaged in the protocol. Research focused on endothelial health confirms that this function is remarkably improvable at any stage of life through targeted interventions. It is entirely possible for men in their 60s and 70s who commit to regular vascular training to elevate their endothelial function to levels comparable to those many decades their junior. This entire discussion is not merely about a momentary boost in performance. It is fundamentally about actively reversing the vascular decline associated with aging and ensuring robust, healthy circulation for the long haul. Furthermore, we must address the significant role of mental state and chronic stress on your vascular system. Persistent stress triggers the activation of your sympathetic nervous system, leading directly to vasoconstriction. When an individual is chronically stressed, their blood vessels are constantly tightened, which inevitably compromises function in numerous ways. The breathing component of this protocol is singularly effective for combating stress. The precise breathing rhythm we employ is one of the most powerful known methods for stimulating the parasympathetic system, thereby actively shutting down the body's stress response. Integrating this breathing pattern into your routine, even independently of the full 5-minute protocol, can significantly lower your resting stress levels and provide a major boost to your overall vascular health. Some find immense value in performing just the breathing portion several times throughout the day as an effective stress management technique, while reserving the full protocol for a once or twice daily practice. This comprehensive strategy addresses both the immediate requirement for enhanced circulation and the persistent chronic challenge of stress induced vasoconstriction. Finally, let's discuss the expected timeline for improvements and how you should track your results. During the first week of consistent practice, the majority of men typically report a greater sensation of warmth, particularly in their hands and feet. This is a direct consequence of improved circulation effectively delivering more warm blood to the extremities. Additionally, some users experience a noticeable lift in their energy levels, which can be attributed to the enhanced delivery of oxygen and vital nutrients to all tissues. By the second to third week, most individuals begin to observe tangible functional improvements. This might manifest as more frequent or more robust morning experiences, a quicker response time, or a general increase in overall capacity. These changes are clear indicators that your vascular system is positively responding to the training regimen and operating with greater efficiency. By the time you reach 4 to 6 weeks of daily commitment, it's common for men to report that their baseline function has returned to levels they haven't experienced in years. While the initial rate of change may slow down past this point, improvements often continue as your body approaches the optimal functional state achievable for your current age and health status. Thank you for taking the time to watch today. If you found this information valuable and based on solid evidence, I encourage you to subscribe for more content dedicated to health optimization. Until we meet again, remember this vital truth. Your vascular health is highly trainable, and a commitment of just 5 minutes per day holds the potential to create a profound difference in your life.